I'm Dr. Jenny Cho. I'm a board certified optometrist here at Noonci, and today in this video I want to go over pink eye. And the most common thing that people think of when they hear pink eye is an eye infection. So there are other reasons why your eyes might be looking a little more pink or red than usual. So I'm going to be going over how to tell whether you have a true eye infection, a pink eye, or whether it could be something else like allergies, dry eyes, maybe an ulcer, some sort of reaction from your contacts. So we'll go over all of those things right now. Let's face it, everyone has had some sort of eye infection in their lifetime, and the biggest thing to know is whether it's worth going to a doctor and getting a prescription for it, or whether there's some over-the-counter drops that can help solve your problem. So a lot of the times, actually, over-the-counter drops do help with a lot of eye conditions, but they have to be the right drops. So I'm going to be going over some of my personal favorite recommended over-the-counter eye drops that you can use if your type of pink eye isn't something you have to go to the doctor for. Okay, I have this really bad pink eye. It looks pretty red and angry. I don't know whether I should go to the doctor. It kind of hurts, but it kind of doesn't. So what are some of the things that you need to look out for in whether you need to go to the doctor right away or whether you can try some over-the-counter drops first? The number one thing you want to look out for when you have a red eye is whether it's getting really sticky. So sometimes people will wake up with really sticky eyelashes that are kind of glued together. That is a very typical sign of an eye infection. So if your eye is goopy and they're stuck together and it's really hard to get all of that gunk off and it comes back throughout the day, you definitely have an eye infection. It's worth going to see a doctor for it and seeing if there is something that you can take to help make that go away or feel better a lot faster. But do you really have to go to the eye doctor? Let's say you're in a position where you can't go right away or you really don't have access to a doctor near you. The best thing you can do is actually just keep your hands away from your face. Do not touch your eyes and do not touch anywhere around your face whatsoever actually with your hands as long as they're not clean. So you really want to make sure your hands are absolutely clean before you go anywhere near your face. And the only reason you need to be actually touching your face is if you're going to be washing your face in the morning, at night, or you need to brush your teeth. Or putting on makeup for those women or men out there. You want to keep your hands clean and washed. Do not touch your face whatsoever throughout the day because that could have caused the infection in the first place. So your hands are clean, they're washed. Now what do? If it's really an infection situation, you want to get rid of any makeup that you are using during the time you had the infection, contact lenses that you are using, and change out your towels and pillowcases. Plus, try to disinfect all surfaces where other members of your family might be touching them, such as doorknobs or light fixtures. And then also, if you can, try to stay away from others at work. And again, keep your hands clean. So what are the other signs of an eye infection that you may have? So let's say your eyes are not goopy in the morning, but they are a little bit crusty, like in the corners, and you get a little bit of tearing. Is that an infection? It might and it might not be. If you do not have goopy eyes, but your eyes are tearing and you get a little crustiness, it could be either a mild infection, like you're fighting a sinus cold, or it could be dry eyes. So crusting in the mornings means that your eyes are actually dry and dehydrated. The crusting is pretty much just your tears that have evaporated the water. And what you want to do for that situation is first grab some over-the-counter artificial tears. The one that I always recommend to my patients is Refresh Plus, and I'll link all the products I recommend down below, so please feel free and scroll to the bottom of the description box if you want to look up any of the products I'm mentioning here. But I definitely recommend the Refresh Plus, and the biggest reason is that it has a great hydration barrier it creates for the eyes. Plus, it does not have preservatives. So they come in these little twist-off vials that are technically single-use, but you could use them again the next day as long as you're extra careful of not touching it to your eye, and then you keep it in the fridge so it stays nice and clean. Other than that, you want to keep using those drops as much as you can throughout the day. Every hour if you can, but at least every 2 or 3 times during the day. That really helps with dry eyes, but then also if you are fighting off a mild cold, it can also help with reducing inflammation. Another thing that you might have are itchy eyes. So if your eyes are very itchy, it could be maybe an infection. It could also be allergies. So how do you tell whether one kind of itching is from allergies or an eye infection? It goes back to the first sign of an infection, which are the sticky, goopy eyes. If you have sticky, goopy eyes and they're itchy, it's definitely an eye infection. If you have, let's say, watery, itchy eyes, but they're not necessarily goopy, they're just kind of red and itchy, then it could be from allergies. So a big allergy over-the-counter drop that I also recommend is called Alaway. And it's an over-the-counter antihistamine drop. You get a decent sized bottle and you only need 1 drop to last you for the entire day. If you do want to do one more at night to just cover you while you're sleeping, you can do an extra one at night. But the big thing with this that I love is that it's fast acting. So once you put the eye drop in, you will feel a sting, by the way. So you will notice that there will be kind of like this onion in your eye feeling. But after that, the itching should go away in about 5 seconds. This is if your eyes are really itchy from allergies. Again, for an eye infection, this may work temporarily, but you'll notice your eyes will get itchy again after a few minutes if it's an infection. If it's from allergies, the antihistamine Alaway drop will work wonders and it will last 12 hours for you. So that's a great over-the-counter. Let's say you do not want a drop that makes your eyes sting and burn. There is another one called Zaditor, and Zaditor is an over-the-counter antihistamine as well. And it used to be actually a prescription form of an antihistamine drop that has been transferred to over-the-counter. And the thing with Zaditor is that it works great, but you do have to pre-dose yourself, which pretty much means that once you do put the drop in your eye, it takes a few minutes before it starts actually working. And sometimes it might even be an hour before the antihistamine drop actually kicks in, versus the Alaway, which gets rid of that itching right away. So how I would use these drops is if you are really itchy and you just need to get rid of that itching right away, you can't help but just rub, use the Alaway, put a drop in, and then you're good. But let's say if you're going through seasonal allergies and you want to prevent that really bad itching watering from happening, then just put a drop of the Zaditor in your eyes in the morning and that should cover you for the day. So far we have covered dry eyes and allergies. And let's say you wear contacts. For contact lens wearers, it's a very different situation because contact lenses are an actual barrier on your eye, which actually can cause a lot of issues on the surface of the eye called the cornea. So let's say this is the cornea and then this is your contact lens. Your contact actually sits on top of the cornea, and every few seconds your eyes are blinking on top of that. So then you have another layer where your eyelid is constantly blinking over this lens, and it's actually creating the lens to move a little bit on your eye. So typically your eyes, when they're in their healthy state, would be fine with a little bit of that movement. But let's say you've slept in your contacts, you've worn them way too long, and they're old. That type of a contact lens will actually cause a lot more friction on your eye, and it will cause a little bit of micro scratches on your cornea. These micro scratches can leave your eyes really red and irritated, sometimes even painful. And if it gets really bad, it can lead into an abrasion, which is pretty much like a scrape on the eye, or an ulcer. And you do not, absolutely do not want to get to the point where you have an ulcer on your eye, because I've heard from so many patients that I've seen that have corneal ulcers that it has been the most painful thing they've ever experienced in their life. So please do not overwear your contacts. Take your contacts out at night. Make sure they're a fresh pair you're using. If you can get into a daily disposable contact lens, please, please, please do it. Daily disposables significantly reduce the risk of corneal infections and ulcers because you're using a fresh lens each and every day, and then you're tossing that lens out. So there's nothing that's going to be reinserted into your eye. Let's say if there happens to be some sort of dust particle on it, or if you do have some bacteria that got stuck on there or a virus, you're not going to be putting that in your eye the next day. I know a lot of contact lens wearers out there that do not properly disinfect their contacts, and even with the disinfection process, there's still a lot of risk of actually handling the contact every day for a month that you're going to be reusing. So just, if you can, get into a daily disposable contact, but if you're in a reusable lens, make sure you throw them out when they're supposed to be thrown out, and then also clean them extra carefully each night and make sure they're off before you go to sleep. So I've gone over the basic things that could be causing your red eye, which are an eye infection, dry eye, allergies, or from your contact lenses. If there is a situation where you cannot go to an eye doctor, what I would do is I would first of all grab the Refresh Plus, use it 3 times a day, and the Refresh Plus is the dry eye drop, by the way. Use that 3 times a day. Then I would also grab an Alaway, which is the over-the-counter antihistamine. Or you can choose to do the Zaditor. I just prefer the Alaway because it's faster acting, and then use the Zaditor twice a day. So if this does not help within the second day, or you're in an extreme amount of pain, please go see your eye doctor, make an appointment, let them know what's happening, what you've already tried using, what you think could have happened or caused the red eye that you're getting, and just see your eye doctor, because your doctor will know exactly what's going on and they'll be able to prescribe you the drops that you need. What I typically prescribe for my patients who do have red eyes are a mild steroid, and what this does is it helps reduce inflammation, especially if your eyes are extremely red and uncomfortable and puffy. The only thing that can sometimes help is using a steroid eye drop. Some practitioners like to use an antibiotic only. I don't really believe in using an antibiotic unless you know for sure it's a bacterial kind of infection, and bacterial infections are actually not as common as the viral form. So usually we would see the bacterial ones in younger kids, like the pediatric ages, probably in the younger teens and lower, but anyone that's in their adult ages typically would have an eye infection from a virus. And a virus does not go away when you use an antibiotic. It actually can create something that is called bacterial resistance if you use an antibiotic unnecessarily. And bacterial resistance is a big problem in the medical community. We're getting things like MRSA, and also there's certain medications that are almost obsolete because it's been used so often and it's just not effective anymore. So if you can avoid using an antibiotic as much as you can, it is advisable just for your own health, but then also for the greater health of our community. So please do not use an antibiotic unless you really need it. A mild steroid is all you need typically for a really bad inflamed red eye. But also, if you can get away with using some of these over-the-counters like the Refresh Plus and the Alaway, then that would be even better. Viral infections go away within a couple weeks. Each day it should get better and better. But also, with viral infections, sometimes they could come up from other things that you're going through as well. Like if you have a sinus infection or a respiratory cold, if you don't address the sinuses by either using a nasal spray or some sort of saline rinse, there will be a backup of that mucus that's an infected mucus up into the eye duct area of your eye, and that can cause an eye infection as well. So please take care of your mucous membranes in your nose. Also, if you're going through any sinus kind of infection, just so that you're not backtracking it into your eyes. Same thing goes for a cold. If you're blowing your nose or coughing a lot, things can backtrack into the eyes as well. So just be extra gentle when you're blowing your nose. So to recap, when should you see an eye doctor? If your eyes are sticky and gooey and no matter how much you clean them, they keep coming back. If you're in a lot of pain, definitely see your eye doctor right away. Pain is not good. That means there's something that has really damaged the cornea, which is the very delicate protective layer on the front part of your eye. So you really want to see an eye doctor if you're going through any pain and your eye is super red. So if your vision is blurry for any reason while your eye is red, or any other reason for that matter, please see an eye doctor, because there's something seriously wrong if you've noticed that all of a sudden your vision is blurry or you cannot see, or there's something in the way. Definitely see your eye doctor if this happens. Other than that, other than those three major reasons, you do not have to see an eye doctor right away for an emergency, but you should still see an eye doctor if you've tried the Refresh Plus artificial tears, you tried the Alaway, it's been a couple days and nothing's getting better. Definitely see an eye doctor if these things are happening within the next few days, because you might need a prescription eye drop. For the rest of it, if you are kind of uncomfortable, your eyes kind of itchy, they're a little bit red, they're a little bit crusty, they're not feeling that bad, you can definitely get away with these over-the-counter drops that I've mentioned. And also, if you are just curious in whether your eye is going through any kind of an infection, just ask your doctor. It's always just a peace of mind thing. A lot of doctors now can do teleconferences or video conferences, so if you just have questions, just give your doctor a call and they can always recommend something for you. A big telltale if you have an eye infection and your eyes are red is if your family member or your friend that you were in close contact with has an eye infection. That's very likely that you might have gotten your eye infection from them. So it's probably safe to just assume that you have an infection at that point. The most common things that I typically find if someone does have a red or pinkish eye is that they have dry eyes, and the Refresh Plus helps really well. There is another drop I can recommend for dry eyes specifically, and that's called Refresh Relieva. This one has a milky texture to it. So it actually prevents the evaporation of water from the eye surface. So when you put the eye drop in, it has kind of like a nice moisture coat. You will feel a little bit filmy with your vision for the first 30 seconds of using this drop, but after that it should be nice and covered, and then you have a nice moisturized set of eyes and eyes that don't feel dry and gritty. Dry eyes typically tend to be really gritty feeling, or they will feel kind of sticky when you blink. You won't get the sticky kind of matted goopiness to your eyelashes, like as in an eye infection, but with dry eyes, you will still feel like every time you blink, it's almost like your eyelids are kind of sticking to the surface of your eye. So it's almost like it has a harder time blinking. That's a sign of really bad dry eyes. What I've noticed personally, if my eyes feel dry, is that I've noticed that I'm not drinking enough water and that I'm dehydrated. So please drink water throughout the day. If you can think of it, every time you are sitting at your computer, especially, drink a bottle of water. Just have some water around you and your eyes will feel a lot better for it. So these are the top signs that you might have an eye infection, and then also some reasons why you might want to see the eye doctor and why you might not want to see the eye doctor right away. So if this video was of any help, please give it a thumbs up. And also, if you'd like to see more informational videos like this, please subscribe and hit the notification bell next to it so you can be notified of when I post a new video. And I hope to see you next time. Bye.